Q here. Today I want to discuss one of the most important lab markers that's readily available that most people have probably never heard of, and most GPs are not ordering this as part of a patient's annual blood work, and that is the omega-3 index score. So what the omega-3 index score is, it's looking at a percentage of EPA and DHA in a patient's red blood cell, and EPA and DHA are the two most important omega-3 fatty acids. A lot of research showing benefits involved in cardiovascular health, neurologic health, brain, eye development, function, cognitive health, inflammation management. So omega-3s are well known for being anti-inflammatory, whereas their counterpart, omega-6s, they tend to be more pro-inflammatory. So we want to have a nice balance between the two. And most patients tend to get more omega-6s in just because they tend to be more prevalent in the diet. Omega-3 fatty acids, as far as a food-based source, the EPA and DHA, those are going to be strictly in seafoods, and unfortunately most Americans, they're not consuming adequate amounts of seafood or any at all. So the only other option then for those people are to make sure that they're getting some form of a supplement in, and probably the most popular and well known are going to be a fish oil supplement or cod liver oil. So the omega-3 index score helps patients and providers know where a patient is and how much supplementation we would need to support them with. And then we can check this about biannually, every 6 months, to make sure that the diet and the supplement is enough to get them into the optimal range. So an optimal range of what we're shooting for on this test is going to be between 8 and 12%. The lower we get, the more the cell function is going to be affected, and generally the more symptoms patients will notice. And this could be involving pain, it could be involving cognitive problems, so maybe it's trouble focusing or concentration or brain fog. So these are just some of the kind of common clinical findings that patients may come in with. So if this is something that you're unaware of, I would highly recommend that you talk to your GP about this. I also am going to leave my clinic info below in the description box, so if you want to reach out and ask me any other questions, feel free to. You can comment below on the video. I'm also going to provide a link to the lab. I use OmegaQuant as one of my labs, and they offer home kits for patients to check omega-3 index scores, and they have a couple different panels depending on how in-depth you want to go, but generally for most people the omega-3 index plus is a really good starting point. And like I said, I'll put that link in the description box below, so if you have any questions, please feel free to reach out. Thank you.